Yes, we've talked about the risk factors. Now, we have to talk about what we are going to do to make sure these risk factors are far away from us. Um, First, we are going to tackle them. We're going to talk about obesity. What are you going to do? Your diet is the first thing. When we go to the gym, they say sometimes that you don't lose weight in the gym. That's not true though. You lose weight in the gym, but also they say you lose weight in your kitchen. So if you find yourself obese, maybe I'll make another video, to talk about how to measure your BMI, the ones that are obese, the ones that are not. That will be another video. But for now, how do we cut down obesity? As I told you before, when I said I was obese, people were not saying, they say, you're not obese, you just added small weight, baby weight. But I measured my BMI and I was actually obese. So I had to do something about it. And you have to too. You know, when you measure your BMI, you know your baseline. So you know what you're working with and what you're working towards, right? So your diet, how are you going to do it? You have to cut down. I'm not a dietitian, so you might have to engage a dietitian, to talk about your meal plan, your diet. And please, there's something we do that we cannot sustain. Please, you don't modify your diet in a way you cannot sustain it, because you're just setting yourself up for failure you know so for me, I had to cut down some things. I had to increase my vegetables and my protein intake, and then I reduced my carbs. I eat all the carbs I like. I eat yam, I eat rice, I eat gari, but I make sure it is in very small quantity. My gari does not pass my fist size. So that's all I do, and I take my vegetables and I take my proteins. So that is what you have to do. So you have to talk to your dietitian after you found your BMI. You have to talk to a dietitian to know what is best. I'm not going to tell you. They have to assess you and tell you how to eat, right? So that is it. Then so you have to cut down what you have to cut down. You have to replace some things that you have to replace. Some of us, chicken has oil already. Why are you putting excess oil? So we can cut down some processes, change some processes. If frying with oil will put too much oil in your food, why not grill it? Why not use your oven? So those are the things. And when you're done frying, some of us will not have ovens, but use minimal oil. Chicken has oil. You can boil and let the water dry off, and that can give you, some kind of crispy chicken too. It doesn't have to be fried all the time. You need to learn to change some cooking methods. Even if you like fried food, you can change it. You can change your taste buds. It's little by little, and these things change. You get? Then we have to, some of us that have family history, you need to learn how to use less salt. Some of us, we have to put salt. You're frying plantain, you put salt. You're doing this, you put salt. The salt has to taste very well, or else you've not started cooking. Rice, or people's rice, if you taste it, the salt inside. So please, you have to train your taste buds to feel okay with reduced salt intake. You have to start it small, small. Your taste buds will actually get used to it. It will get used to it. You just have to start. Then, I've talked about less oil. You need to change your cooking methods. You don't need to fry all the time. Boil. You don't like boiled yam, but try. You will like it. Little by little, you will like it. Incorporate more vegetables. Even if you don't like vegetables, try. Try to do it in a way you will like it. I don't like cucumber, but it has fiber, so I put it in smoothies just to take. So learn to do some things, that you don't like. Try to be creative about it. There are I never like beetroot, but I put it inside juices. I put inside zobo. I put it inside smoothies, just to get the benefits. Then when you come to salads, I don't like um, some of them. I like cabbage a lot, so I do a lot of cabbage. I do a lot of carrot. I do a lot of green peppers. So the ones you like, eat a lot of them. You don't need to eat everything. That's the truth. You don't need to eat everything, but make sure you're eating in a good quantity. Your fruits, you find the ones you take them, take the fiber, take everything. Now, smoothies and juices can be tricky because you're taking a lot of sugar too. So it's better you eat your fruits whole because you get everything, you're filled up more, and you don't take too much sugar. So as we are doing those things, you have to watch too. Then for sedentary lifestyle, we need to move more. I don't know how else to say it that will understand, but we actually need to move more. you know some of us, the remote work, sometimes it has made us so averse to movement. We don't go out, we don't do anything. We just stay at home, we eat, we sleep, we work. Some of us, we don't even have work times anymore. You work from morning, rest a little, continue in the middle of the night, all those things. Your body needs your rest, so take that rest. The night is for sleeping. Try to sleep at least 8 hours every day. Nothing. Gone are those days when they say, you need to make money, you don't need to sleep. That's a lie. You can sleep and make your money. So please, let's look into that. Then, about moving more. You're at home, nothing. If you live in a gated estate, there's nothing stopping you from taking walks. You can walk for 30 minutes. If you need to get a fitness watch, do that for yourself and time yourself. Oh, walk 30 minutes. Oh, I need to do 10,000 steps a day. You don't have to do it at a stretch. You can break it down. Our phones even record these things. Once you're carrying your phone and you're moving up and down, it's recording your steps. So we need to, take care. Our smartphones are here. If you cannot get a smartwatch, you have your smartphone. There are fitness apps everywhere. So do this and monitor your health, okay? And there are other things you can do. If you like bicycle riding, it's a very wonderful exercise. Ride your bicycle around. Ride it. You have to go somewhere. You don't have to drive. Take a walk. You understand? You get to work. You don't have to use that lift. Your office is on the 10th floor. Take a walk. Take the stairs. Your health, your heart, your blood pressure will be happier for it. Okay? So these are some of the things. You don't have to do highfalutin stuff. You don't have to do something so stressful. Yes, some people like me love the gym because I get motivated. I see people working out, it pushes me to work out more. I have a trainer that pushes me. So yes, I have to. When I started, I told you my BP was high, so I had to do cardio for a month. You understand? I had to do cardio for a month just to get my heart pumping right. So, and he got the routines for me. So yes, going to the gym helped me. So you have to choose your poison. You have to choose what will work for you. For me, it was going to the gym. For you, it might be something else. It might be putting on some dancing exercises and doing it at home for 30 minutes. So all you need to do is make sure you're moving, make sure you're not in a place, make sure you're not just existing every day, sitting down, not engaging in any physical activity. Okay. The next thing, please, I know this one might be difficult for some of us. We like to flex, we like to party, we like to some of us even call ourselves social smokers, social this, social drinkers. Yes, I only drink when I go out. Please, you only drink when you go out, and when you go out, you take 10 bottles of beer. No, that is not how it's supposed to be. So please, let's try. Some of us might not be able to cut it off completely, but you can. You have to start by reducing, okay? Start by reducing. You used to take 5 bottles. Tomorrow, reduce it to 4. The next day, reduce it to 3. The next day, reduce it to 2. By the time you know it, you're okay. You can stay days, months without any alcohol intake. Okay, you can stay days, months without smoking. And please, those involved in drug abuse, you have to stop this because it is not good for your health in any way. is affecting you mentally, is affecting your relationships with people, is affecting you economically. It's not okay. You spend your money on things that are not necessary, because if you say you're feeling depressed and the drugs make you feel high, when you get low, those feelings come back. So that has not solved any of your problems. So what do you need? Please, if you need to see a psychologist, please, these people are experts, they are professionals. They are going to take care of you. They will talk to you. You don't need to take all these psychoactive substances just to feel better. No. So engage the services of these professionals. They are there to help you. You can get your dietitian, get your psychologist, psychiatrist. They are not it Psychiatrists are not for mad people. No. Even mad people, they have some mental people we call mad. It's some mental illnesses that could have been taken care of. So please, I beg you, engage the services of these professionals. They will help you. Another thing to do is to try to, check our bodies regularly. You can do even the smallest ones, checking BP, checking your blood sugar. You can walk into any pharmacy that has um, a BP machine, and they're going to check your BP. Even if they say they're not doing it for free, they will just take a token. It doesn't take much. Put on your this thing and check your BP. You can do it every week. You can do it also depending on how your BP is. My gym has a BP machine, so when I get there every morning, I check. Oh, it's good, it's okay, and I continue my workout. But any day I see okay, it's high, I know that okay, something is wrong. So you have to be able to check your BP. If you don't want to go out there, if you can afford a BP machine, it's not a bad thing to get. So please get that for yourself and use it. But if you cannot, walk into any pharmacy, you can check your weight, you can check your BP, you can check your blood sugar. Remember, I said diabetes is a risk factor for hypertension. Then we can always, once in a while, you don't have to do it all the time. For those of us that have insurance, it may be covered, it may not be. You can do a full body check just to check, oh, everything is working properly, my kidney is fine, my liver is fine, my organs are working appropriately. So let's do this, okay? Then reduce your stress. I've already talked about sleep. Sleep is important. Gone are those days when we say, oh, you don't need to sleep. You don't, when you want to make money, you don't need to sleep. You need to sleep for you to make money and enjoy your money without, having some debilitating illness. So I hope I have been able to educate us about hypertension today and how it is affecting us. I hope I've also been able to pass the information on what we have to do, how we have to live just to cut this problem down among us. I hope we are all taking this into consideration, and I hope we improve our life. Bye.